Hi, guys. Happy Tuesday. I hope you've had a fabulous day. It's been a great day here at DMA Weight and Wellness. We've been kind of calming down from the electronic medical records change that happened about 3 weeks ago, even though things are still very chaotic, very crazy. We're getting better. I tried something new. I taped my notes up here, and I don't really like where they're at because I can't see certain other things on my screen. So I might move them around a little bit. So today, I promised you I'd be back after last week and things being crazy, which I am here. Still a little bit discombobulated, disorganized, but I'm getting there. I want to talk to you about why in the world should you cash pay or even consider cash paying for any healthcare services, whether it's my services or someone else's. There's benefits to this model, and I want to be very open and honest as to why I think you should. I was very open and honest a couple months ago when I broke the news that I am moving to a cash pay model at the end of the year. I gave you all of my reasons for why, and most everybody understood them, but I got a lot of nose wrinkles and sad faces and things of that nature. But let's just be honest about why we should. So let's first talk about the insurance-based model. So the insurance-based model, everybody's pretty familiar with it. You go to your doctor, you give them your insurance card, you maybe do a copay, you may have a deductible, you go in, you get your care, and you leave. This model is a volume-based model. So it is set up to be driven, the revenue's driven by the volume. You see more people, you get more money. And pricing is set in a certain way to where you have to see more people. So continually throughout my career, when I've been on a cash pay model, I'm constantly trying to increase my volume or my numbers so that I can actually maintain the same salary that I have over several years. Well, that volume, this insurance, it creates a higher overhead. So you've got people that bill your claims, people that contract with the insurance companies, people who you have to hire to follow their quality programs, which, side note, I have yet to see an insurance quality program that actually increased the quality of care for any of my clients. You know, they make you take all these ridiculous little mental status changes, things which I can get just from having a conversation with my clients, spending more time about what is important with them and understanding I can get where they're coming from the mental side. I've yet to see any of these quality programs actually improve quality care, but we'll digress. At the end of the day, an insurance-based model, the insurance is in control of your care. They're in control of your provider. They make the recommendations on what lab tests we should order. In fact, just this week with the new electronic medical record system, I felt strongly that a patient should have a full thyroid workup. So when you go to most primary care doctors or general doctors, you ask for a thyroid test, you get what's called a TSH. That is like one of 5 different labs that I think you should have done to truly screen for thyroid disorders. Well, they flagged me and told me I couldn't order it. And so here I am spending 10 to 15 minutes trying to find some diagnosis to justify me ordering the test that I feel like my client needs, all because the insurance company says, no, not with that diagnosis. You have to keep finding it. So it's a waste of my time. It's a waste of the client's time. And they're not getting necessarily the care that I need unless I'm sometimes even having to make up diagnosis just to get the test covered. They basically interfere with the doctor-patient relationship. They come in between that as decision makers instead of the doctor and the patient, or the provider and the patient being able to decide and dictate the care. So that's kind of insurance model basics. Let's talk about why you might want to break free from that model or even utilize services inside and outside of your insurance company. And I'm going to list a couple different reasons here. So the first one is that the provider and the patient are back in control of things. That doesn't mean that when you go to a cash pay office, everything is covered there. So when you come in to see me, I'm not going to hand you your medicines like the pharmacy. I'm still going to send your medicines to the pharmacy. You're still going to use your insurance for that side of things. It's just what we do within our walls and the decisions we make is up to us and not dictated by insurance. I don't have to worry about, am I meeting their metrics? Am I meeting their goals and prescribing the medicines they want me to? Or am I doing what is appropriate for you as your individual person in that situation? So it definitely just puts us back in control. I love the term individualized medicine. And that's because what works for you is not going to work for your neighbor or your best friend or your husband or your spouse or your wife or whoever. It's you. You are your unique being and you have unique needs. You've had unique exposures to things over the year. So individualized medicine, it takes time. It takes your time to get better. It takes my time to investigate and to figure out the ins and outs of what's going on. And when you're in an insurance-based model, time is not something you get. If you get 10 minutes with your doctor, you have won the lottery. So, in my new model, the smallest visit is a 20-minute visit, but most of them are 30 to 60-minute visits so that we can have the time to individualize your care, to find out what's been going on with you, to make sure that we fully investigated to find the root cause of problems and not just stick band-aids on it. And that's just not something I could do in the insurance model, but it is the reason why paying for your care gets that. And I've talked to other doctors, like I've talked to Julie Perrigan here in my local hometown that's been doing a cash pay model for years now. And that's been one of the number one things that her patients have said has been a positive is whether they need 5 minutes or they need 45 minutes, they get to spend the time that they need with her when they need it. And she's accessible. Which brings me to my next point is I truly believe that a cash pay medical practice is more effective care. I already talked to you about the whole meeting the metrics and the quality programs and all of that, but it truly allows for holistic wellness. So currently the insurance model is only going to pay for services that are conventional medical treatment. So the conventional labs that they want you to draw, the conventional medicines they want you to draw, conventional workups, they're not going to pay for us to look to see if there's been environmental toxins and exposures. And, I found quite a few of those lately as patients are wanting to pay to have some of these tests done. Do we have extra plastics in our system? Do we have mold exposure? All of these things are things that the insurance model doesn't pay for. But what it also allows, this holistic wellness practice, it allows more connectivity to you and me, to you and my staff. Because like I said, this does take time. And the more connection you have with your care team, the better your outcomes are. So that's better connecting with the coaches. And in my previous model, I was only able to give health coaching to those people who were in the first 3 months of their weight loss journey. That's off. That is different. Health coaching is available to anyone who wants it. It's included in our packages. And if you can't afford one of the packages, but you can just afford to see the health coach, guess what? You can do that too. You can come in and just get the coaching and things of that nature. More connection to community. I could not do community groups in my traditional insurance practice. But when you're trying to make life change, it's hard. We are surrounded by a very toxic world, a toxic system, high stress, busy going craziness. And this is nothing that I could add before because we need community to make those changes. The community helps us feel less crazy for making some of those changes. So in our new practice, we're adding online and in-person community groups so that you can come and connect with us and connect with other people so that you don't feel like an outlier. You're out there making changes and there's other people who are like-minded that are doing it with you. And that's another thing that if you can't afford our full package, you can just join the community groups. And I've been very careful not to post pricing online because I feel like that's something that you and I need to be discussing individual, but that is something that I am going to tell you about with our community groups. So like if you just want access to a once a week community group, like-minded people, online, in person, it's $23 a month. For a year, it's a little less. It's $250 if you want to join for the whole year. And you have full access to come in and go. I'm going to be leading those. My staff is going to be leading those. It gives you more connection to me. So this cash pay model gives you more access to your provider. I think we've covered that one. More connection to learning. And this one's a big one. For me, it is, but it's also for you. So in our new practice, we're going to create an online database of learning that you can go in and learn in between your visits, different topics. Now, it's very minimal right now. That's something I'm going to be able to grow. I'm going to be able to put more information out there so you can access it. But this is not just your learning. It's my learning. It's my staff's learning. So in the traditional model, I'm scraping to find time to read articles, to listen to podcasts, to get into the journals, to dig in and learn and keep up on all the science and even all the science that I've missed over the last 20 years I struggle with. This different model gives me time. It gives me time to make sure that I'm staying up to date so that when you come in, I can give you the best available advice possible in that moment. And who knows what's next, whether it's adding strength coaches here and athletic trainers and things like that. I don't know what's next outside of what I've already planned, but I know I'm going to have the freedom to do it because I'm not restrained with what does insurance reimburse me for. So, health coaching, there is a code for health coaching. It actually got added a couple years ago. And the idea was to make it more accessible to people and for insurance to reimburse it. Does it reimburse? No, it does not reimburse. I can bill it all day long and I'm not going to get anything back on that reimbursement code. All right. I like this one and I hope you guys like it too. This next point is a cash pay model is about preventative medicine. Insurance likes to say that they are about preventative medicine. They are not. They're about detecting and screening. Is your mammogram prevention? It is not. It is detecting. If it's seeing if cancer is already there, it's not preventing it. Is your PSA level preventative? That's the prostate test to test for blood for cancer of the prostate. It's not. Is your colonoscopy preventative? It's called a preventative colonoscopy. It is not preventative. It is looking to see if disease is already there. Well, what I want to do is help you figure out how to make sure it never got there in the first place. That's what true preventative medicine is. We're also told that, like when someone has diabetes, putting them on like an ACE inhibitor or this new class, the SGLT2 inhibitors that make you pee out sugar, is preventing kidney damage. It's not preventing anything. It is slowing it down. It is putting some band-aids on it. It's maybe delaying the onset, but it's not preventing it to start with. That's where I want to be. I want to be there. Let's get there before we ever need the medicines to prevent anything. Let's fix it and get rid of it. So I hope you believe the same way that I do, that preventative medicine should really be about preventing the disease and not just screening to see if it is already there. So in a cash pay model, you also have access to different testing. And you can actually have access to this in a traditional model too, to be fairness. It's just most providers have no clue what environmental toxins are and how to screen for them. And I can use a personal example. Someone very near and dear to my heart had a heart attack, and this was just within this last year. If you know me personally, you know who this person was. It wasn't a blockage of an artery that caused this heart attack. It was something inflammatory that caused a clot to get there. Well, when we dug into it, it was a glyphosate toxicity. And even to this day, other providers are like, I've never heard that. I've never heard that glyphosate could do that. Well, glyphosate increases inflammation in the system. He had also had COVID. He had also had a brown recluse bite. And all of these things make clotting and things happen in the system. But we're now detoxing from the glyphosate. But had I had to use traditional medicine to try to find that test and order that test, his insurance didn't pay for it. We had to go all outside of the insurance model. And sometimes when the body's broken, you have to get outside of the insurance model to find it, because you have to search and dig through the weeds that other providers are tied to not being able to order. Because like I said, this week, I just wanted a basic thyroid panel, what I consider to be a basic thyroid panel. And I was told absolutely no. All right, I already talked about education. That was on my list. So the next thing that I would like you to know is there are some instances you can still use your insurance in a cash pay model. So for example, for general basic blood work, I'm still partnering with the Dixon Medical Associates, the company that I've worked with for 9 years. I'm also partnering with LabCorp and other things. So you can potentially still use your insurance to bill for lab work. Even though my name's on it, my name is not what makes it billable to insurance. It's just the test and the codes that are on there. Also, when you go into any cash pay office, they should give you what is called a super bill. And I've talked about this previously, but the super bill is the form that is currently sent by my employer to the insurance company to collect reimbursement. Well, I'm going to give you that same form. It's detailed. It has the diagnosis on there. It says how much you paid, and you will send that into your insurance company to collect out-of-network benefits. Now, if you have a high deductible, it's probably cheaper for you to see me and not even bother sending it in than it is to even touch your insurance and just leave your insurance there for catastrophic reasons like car accidents, major surgeries, things of that nature. But if you don't have a high deductible, you're one of those copay people, you send it back in. And so like under my insurance, I get like 40 or 50% reimbursement for out-of-network. So when I send that in, I get back 40 to 50% of what I paid in. So you still can use your insurance to offset the cost and be smart about it. It's a pretty easy process. I've done it before. When I had my daughter Willow, there was not a lactation consultant anywhere in this area. And I had to find one because I was needing to feed this baby. So I used an out-of-network one. She gave me the super bill. I sent it in. It took about 4 weeks and they sent me back 40% of what I paid the consultant at the time. So The next part I want to move into is it might step on some toes. And trust me, I am not trying to be controversial. I am not trying to be mean by this at all. But a lot of people, as soon as they hear the word cash pay, they immediately say, I can't pay for that. It's out of my reach. It's out of my realm. Well, I've already told you there's at least the access to the community groups that is not that much. Health coaching is a different level. I realize that some of the plans and things can get up there. But I want to ask you a serious question. Are you prioritizing your health? Is it important to you? And what I find is the things that are important to us, we pay into. And if you feel like you're going to get a better service, a better quality, and in the end, better health that's going to help you through the rest of your life, is that not worth paying into? And I do get a little frustrated sometimes when people either tell me they can't afford certain foods, which I realize there are situations that, yes, that is 100%. They're struggling to put anything on the table. Um, but if I see you drinking a big fancy coffee that costs you about $8 to $9, how many times can we save that away and put it towards healthcare that's going to make you better? If we're drinking one of those fancy teas that I like them too, I like the nutritional drinks. I try to stay away from because they actually spike my sugar. But if you're drinking one of those are costly. Heck, I can't go to Walmart without spending more money than I meant to go in there with and getting a fuss on by my husband because he's like, we didn't need this. Why are you spending 50, 60 extra dollars this trip? Well, I was there and it looked good. We can spend money with the best of them. But when we prioritize our health, we start making that important and we put money towards it. And that might mean, giving up some lunches that you're not eating out, that you're packing, and not eating out at restaurants as much, or skipping that coffee or that tea. But trust me, the health that you will gain from prioritizing yourself and putting yourself first and your health and your needs first is so much more than what the pleasure is you're ever going to get from those coffees and teas, even though some of them are just fabulous. So that's all I'm going to say. And hopefully I didn't step on too many toes, but I'm just saying, make yourself important. And I do believe in the biblical premise of, where your money and heart is kind of match up. And that's very, very true. So at the end of the day, those of you who have seen me in the past, you know me. You know the provider I am. You know my heart because I lay it out there pretty much every time you come in. I am not in this business to get rich. If I was, honestly, I would be selling compound semaglutide shots, and that's a whole nother topic for a whole nother day, which I have pros and cons to. But if I was in it for the money, I would be ordering those and handing them out like candy, like so many other providers are doing in this area and in other areas. If you need medicine, absolutely, I will help you find a medicine that will help you within your needs. But I am not going to try to sell you something other than my direct service myself. I am not in this to be a rich person. I am in this to make a good living, yes, to care for my family, yes. But I truly help people get better, and there's very little that makes me feel better than that. Probably my family are the only things that make me feel better than that because that's my passion. I went into healthcare originally because I wanted to see people get better. And I almost left it before I went into weight management. I almost left healthcare altogether because people weren't getting better. And then I had to acknowledge that I was part of the problem and start treating things different. And now I'm having to acknowledge again that if that's the path I want to keep doing, and I want to see my health continue to thrive and my family's health continue to thrive, then I need to do it a little bit different. So what I'm doing is I'm creating this patient first practice that I hope is going to shine very brightly. And the question I have for you is, are you going to join me? And if you're not in this area, are you going to join somebody else that's in the same boat? Are you going to prioritize your health? Are you going to consider all these positives and reasons why you should consider it and not consider it? And join wherever your means are, because your health is important. It's important to me, but it should be more importantly to you. So join me. All right, guys. I'll see you next time.